Last week, more than 5,400 beds on average every day were taken up with flu and COVID patients. That's up 21%, although you can see that these numbers did start to drop off slightly, suggesting, hopefully, we may have reached a peak. But when we compare that to last year, you can see there's almost a staggering 250% increase in the number of patients with winter viruses. But if we take the data back one more year to 2022-23, we can see that the hospitals are facing roughly around the same number of patients. I spoke to one trust chief executive who said there was no more slack left in the system.
Ward occupancy at the moment is running around 99% of our beds, so we are absolutely full. Our respiratory unit, half of it has been given over for patients with flu, and we've got a lot of very kind of unwell patients in the hospital at the moment. And each morning over the last few days, we've actually been starting the day with around another 20 to 30 patients actually in the emergency department waiting for beds. So the bed pressures have been really significant.
And those warnings are seen in the national targets that are being missed. The NHS aims for 95% of patients to be seen, treated or discharged within 4 hours of coming into the emergency department. But in December, it was a little over half that target. And of the patients that were due to be admitted, some 28% waited for 4 hours before they were actually seen. And that's also worse than at this time last year. Another target being missed is the one for 95% of patients to be handed over from ambulances to hospitals within half an hour. The mean time last week was almost 54 minutes. That's the orange line here, more than 20 minutes slower than at this time last year. Every delay puts patient safety at risk, and while the number of patients with seasonal viruses looks to have peaked for now, there are concerns that the cold weather and with schools reopening, it could cause a further surge and add even more pressure to the NHS.